Dental stain. These are pigmented deposits found on the tooth surface. The color of normal teeth varies and depends on many factors. They depend on shade, translucency, and thickness of enamel. The margin often has a darker appearance and because of the close approximation of the dentine below the enamel. In most people, they complain from a darker canine in the teeth. Of course, we should assure the patient that canine teeth they are darker than the central incisor and lateral incisors. Also, in younger people, we can see a lighter teeth, particularly in the primary dentition. Teeth become darker in color as physiological age change, and also they may complain from a darker teeth. This is because of the lying down of the secondary dentine, incorporation of the extrinsic stain, and gradual wear of the enamel, allowing greater influence on color of the underlying dentine. Of discoloration. We have extrinsic discoloration, intrinsic discoloration, and internalized discoloration. Extrinsic discoloration. Extrinsic discoloration is outside the tooth substances and lies on the tooth surface or in the acquired pellicle. The origin of the stain could be metallic or non-metallic in origin. These are lists of intrinsic discoloration, which involve alkapnuria, congenital erythropoietic porphyria, congenital hyperbilirubinemia, amylogenesis imperfecta, dentigenesis imperfecta, tetracycline staining, fluorosis, enamel hypoplasia, pulpal hemorrhagic products, root resorption, and aging. Internalized discoloration. Internalized discoloration is the incorporation of the extrinsic stain within the tooth substance following dental development. So it occurs in the enamel defects and in the porous surface of the exposed dentine. The routes by which pigments may become internalized are through developmental defects or acquired defects, such as tooth wear and gingival recession, dental caries, and through restorative materials. Non-metallic extrinsic or exogenous stain. This involves the brown stain. Brown stain occurs in individuals who don't brush their teeth sufficiently. Also, accumulation of the dental plaque, calculus, and food particles cause a brown stain on the maxillary molars and the lingual surface of the mandibular incisors. Deposition of the tannins found in the tea, coffee, and other beverage may cause also a brown stain. Tobacco stain. It is dark brown or black stain result from dissolving of the tar within the tobacco in the saliva, and it is easily penetrate the pits and fissures of the enamel. It mostly occurs frequently on the lingual surface of the mandibular incisors. Green stain. The green stain mostly occur in children and young adults. These occur due to a special bacteria and fungi, which are Penicillium and Aspergillus. These are called chromogenic bacteria. It mostly occurs on the facial surface of the maxillary anterior teeth, especially in boys. Also, it is found in the cervical or gingival area, labial surface of the anterior teeth. Black stain. The black stain occurs as a thin black lines on the facial and lingual surface of the teeth, near the gingival margin. It is also caused by a chromogenic bacteria, primarily Actinomyces species. Orange stain. It is also caused by a chromogenic bacteria, and it is mostly occurs on the facial surface of maxillary anterior teeth. It is less common than other type of stain. Chlorhexidine stain. This is a yellowish-brown stain. These are found predominantly in patients who takes a chlorhexidine mouthwash. We can find these stains in the interproximal surface near the gingival margin. The degree of the stain different from patient to a patient according to the patient's susceptibility. Also, it is different according to the concentration of the medication. These are pictures of a chlorhexidine stain. So non-metallic stain includes brown stain, tobacco stain, black stain, green stain, orange stain, and chlorhexidine stain.